The patient will just lay still here on the actual treatment couch. And then what happens is the machine actually rotates around the patient 360 degrees. And patients typically walk in and out of here in about 15 minutes.
Pretty much what it does, it takes, we actually use pharmaceuticals that are targeted to go to different areas of the body. What we do, we inject the patient, and after a certain amount of time, we lay in this bed, and then we do the particular study.
And then this is our stereotactic biopsy room. We do screening mammograms as well as diagnostic mammograms. A diagnostic mammogram is everything else.
Well, for me, this is a return. I started the Comprehensive Cancer Center breast program at the University of Miami in 1975, and I've returned as of April 12th to head the Women's Center here. And I've devoted the past 35 years of my life to breast cancer treatment and research, and I'm happy to be back at the Sylvester.
This gives me great pride and pleasure and professional satisfaction to see that we have a center where we can bring all services under one roof and cancer patients don't have to go around town seeing different specialists. This is truly a multidisciplinary facility with the depth of an academic medical center. We are not just affiliated with the university, we are the university.
And I'd like to welcome everyone to the premiere of the new Sylvester at Deerfield Beach. It's a beautiful evening, and we are so gratified to see so many of you out here to support what we're trying to accomplish and to celebrate with us this milestone in the history of serving our patients in Palm Beach and Broward counties.
This year, over 11 million cancer survivors will celebrate another birthday. These survivors will live to see their children grow old and get married. They'll have the opportunity to create cherished memories with family and friends, go to college, travel the world. But most importantly, because of the remarkable research throughout our country by scientists and physicians, especially the kind of incredible work achieved right here at Sylvester, 11 million cancer survivors have been given the greatest gift imaginable, that of an extended and rewarding life.
As we look at this initiative as a component element, important and key component element of the university's efforts to develop and expand its medical enterprise, the research that's based in the medical school, the clinical care delivery through the University of Miami Health System, you'll find expressions of that regional reach throughout this part of Florida.
In January 2003, Sylvester expanded its cancer service to patients in Broward and Palm Beach counties with the opening of Sylvester in Deerfield Beach and Newport Center, offering a broad range of cancer-related service, including consultations, second opinions, and access to clinical trials. It also hosts educational activities and events and cancer screenings. Since its founding, Sylvester has formed cancer research and treatment in South Florida and beyond. Sylvester is expanding its scope as South Florida's only university cancer center by adding new programs and state-of-the-art options at its Deerfield Beach facility, including a new women's center and radiation oncology center. The premier celebrates and honors the important advancement in the local fight against cancer. Now, therefore, I, Peggy Nolan, the mayor of the city of Deerfield Beach, in recognition, do hereby proclaim November 9, 2010, Sylvester Day in Deerfield Beach.
And he was dying of this disease, and he wanted to come to Sylvester because he heard we had a new drug. So he, through a little bit of machinations and also some generosity on the part of Rich Ballard and Jerry Goodwin, we brought him over from Argentina, and he saw one of our physicians. And he got the drug SGN-35. And for the first time in 7 years, he went into a complete remission. That complete remission with a Sylvester-developed drug allowed him to undergo an allogeneic transplant. And just a few weeks ago, and I showed this at the International Society of Hematology meetings, we got a beautiful picture of him with his sister, the donor, and the transplant was done at Sylvester as well, with his sister, the donor, standing on a mountain somewhere in Patagonia in Argentina, skiing in complete remission. So that story, in a nutshell, is what a translational scientific cancer center is all about. It's about developing new leads, developing new compounds, developing the clinical trials that test those compounds in the clinic, and actually treating the patients and providing options to patients that would not normally exist. We do it, Sloan Kettering does it, MD Anderson does it, and I like to think that we do it better and better.
So if you look at the agenda, I am the grateful patient. It really doesn't say enough. I am the very, very grateful patient. You know, I was never sick a day in my life until boom. About 1.5 years ago, I was diagnosed with MDS. The short version is that my bone marrow was not cooperating with my body, not producing enough red blood cells, and I spent the next 12 months taking naps between sleeping. And I was the living version of the Lost episodes. It was brutal. And then it began, the quest. Where do I go? What do I do? And we started to scour every medical facility, went to see every doctor, every specialist, because we really didn't know anything. And it was a lot of trial and error. And as it turns out, all roads led to here, to Sylvester and Deerfield Beach. And it has proven to be the road best taken. It has really been amazing for me. Some people might say, oh, what a beautiful facility. That kind of sounds too much like bricks and mortar to me. I prefer the other definition of facility, the one that speaks of ease and easiness. And that's really what's going on over here, is difficult things are made easy. And it's evident from the minute I get here every Monday. Covered parking for the patients, flawless reception, and they know your name after the second visit, and they know why you're here and what's going on in your head and your heart. And then you sign in, and then Betty gets to poke at me every week gently, which has really worked out good. And what I have really found is that my team has really become more of a family. You hear that all the time and it sounds trite, but it's not. Trust me, when I come here, when I first came here, I was scared beyond comprehension. And now the visits are kind of, easier. It's a lot easier. So I do want to, against their probably modesty, single out my team, starting with Dr. Glick, who, by the way, is very courageous for allowing me to come up here, because I do give her a run for her money, and she had no idea what I was going to be talking about tonight. So she, aside from being a brilliant physician, and I did leave out one team member. Everybody needs an advocate. Everybody needs somebody there, and I see it in the waiting room all the time. There are mothers with daughters and daughters with mothers, and you start questioning who is the one that's here for the treatment. And so I just want to finish sappily, if that's a word, with a love note to my team and to my wife. You are the knowledge that I needed. You are the hope I almost lost, the courage that has no end. And wherever this journey takes me, I'll have taken it with my friends. Thank you.